Every day, 370 infants die of bacterial meningitis, a life-threatening infection often leaving lifelong effects. Because the prognosis worsens with delayed treatment, early detection can be life-saving. But this detection can be challenging due to the minimal symptomatology of the disease, especially in newborns and young infants who are more vulnerable and limited in their ability to communicate. And sometimes, a fever is the only symptom visible to the naked eye. The only method to detect the presence or absence of the disease is a lumbar puncture, used to draw a sample of the CSF, the fluid that surrounds the brain and spinal cord. It is a painful, invasive, and risky procedure, requiring the assistance of 3 healthcare professionals. Despite the popularity of the procedure, the needle may puncture a capillary with blood, contaminating the sample, reducing the reliability of laboratory results. In cases of non-contaminated samples, health professionals look for an increased number of white blood cells in the CSF. An increase is a high indication of meningitis, and when this occurs, medication should immediately be administered. This medication attacks the most frequent type of bacteria, while the medical team waits for full bacteriological results, which are usually available in 48 hours. Once the cause of the infection is determined, medication may be changed or adjusted. So what's the problem with the current protocol? First, in industrialized countries with a relatively low incidence of meningitis, 95% of infants receiving a lumbar puncture do not have meningitis. Yet in developing countries, where the burden of meningitis is high and lumbar punctures are rarely available, 50% of newborns with meningitis die of the disease. We want to stop this. So we developed Neosonics, the first medical device to non-invasively screen for infant meningitis. A neosonic ultrasound device is placed on the fontanelle of the infant, an area of the skull where bones remain unclosed. With the push of a button, the Neosonics device measures the number of white blood cells in the CSF, all without the need for a lumbar puncture. A reading that finds an increase in the CSF cell count triggers the initiation of treatment, and if available, a lumbar puncture. Neosonics will revolutionize the way the global medical community diagnoses meningitis and will decrease the mortality rate of infants in the developing and developed world. There are 165 million infants at risk of meningitis each year. The innovative work of Neosonics will allow clinicians worldwide to never miss a case.